Hello, it's 11 a.m. here in Seoul. I'm Oh Soo-young at the Arirang News Center. We're breaking into our regular programming to give you a live briefing from the South Korean health authorities on the coronavirus outbreak here in the country. We're going to do that in a few moments, but first we start with news. The number of global COVID-19 cases now has surpassed 3.5 million around the world. The number of deaths worldwide is over 247,000. Infections in Russia rose by a record daily amount on Sunday with over 10,600 new cases, with more than half in Moscow. However, much of Europe is preparing to ease lockdown measures as the spread seems to have slowed. Italy, once deemed the world's hotspot, reported Sunday its lowest daily death toll since the first day of its lockdown. Italy's death toll stands at almost 29,000, with at least 210,000 infections. Now we are going to go straight into the briefing room where Kim Gang-lip, overall coordinator at the Health Ministry here in Korea, will brief us on the updates of the COVID-19 situation here in the country.
Newly confirmed patients stand at 8, and a total of 1,332 people are in quarantine undergoing treatment. The death toll now stands at 252, as we had, unfortunately, 2 more fatalities as of yesterday. I send my deepest condolences to the deceased. Out of the 8 newly confirmed cases, all of them were imported cases, and 4 of them were reported at the airport quarantine, while 4 have been reported on the community level. This morning, KCC had a meeting today presided over by Prime Minister Chung Se-kyun, and we discussed issues in improving the medical equipment and medical facilities and the reopening of the schools, and to intensify the quarantine on the foreign laborers. And he said that the situation is not to an end, and that we need to also continue to curb the community spread going forward. And he said that the future success of our social distancing in daily lives lies in the hands of the public. And he also urged the public to continue to be vigilant and make it a habit to wear face masks and wash hands thoroughly. And he also said that school quarantine will be prioritized, adding that monitoring will be intensified to adjust the level of social distancing whenever it's needed. For the past few days, we are seeing an on-day increase hovering around 10, and a majority of them are imported cases being reported at the airport quarantine. Moreover, the people on quarantine are also decreasing, and we believe that the situation is under control to a certain extent. Nevertheless, a number of global patients are actually on the rise, accounting for over 3.4 million, and the WHO still sees that we are at a public health emergency crisis globally. In South Korea, there are still cases and with the cases with not identified sources, and they account to about 7 up until yesterday for the past week or so, and a majority of them are being witnessed in Daegu, which is a great concern for us. And in Daegu, we believe that there is a still possibility of a risk that we still have maybe a cluster there that has not yet been identified by the quarantine authorities. And moreover, the increase in the movement during the past Golden Holiday week also poses a great risk to the possible infection. And experts say that until we have a successful vaccine or therapeutics, we will see a repeated outbreak going forward. Nevertheless, the current situation, if this lingers going forward, we believe that our medical systems will be able to control the system, and that we need to consider the damages inflicted on our economy and on our daily lives. And we believe that carrying out intensified social quarantine will be difficult going forward. To this end, as yesterday we announced that starting from May 6, we have decided to end our strict social distancing measures and transform into a social distancing in daily lives. However, this does not mean that we will be going to return to the pre-COVID-19 days. However, it's all about writing a new norm. In other words, we will be guaranteeing the daily and economic activities. However, we need to have full responsibility of quarantine going forward. And the quarantine authorities, we have consulted greatly with the experts. And in order to have them practiced in our daily lives, we need to have a fully disciplined public as well as education going forward. And we ask the public to comply with such measures as you did during the general elections and the Easter holidays. And you have the experience of successfully curbing the social outbreak. And if we continue to cooperate going forward, I believe that the Republic of Korea can successfully overcome the COVID-19 while writing a new chapter in history. Meanwhile, the KCDC has in relation to the guidelines, during the past 2 weeks, we had an online survey to gather the information and opinions from the public, and about 8,700 people have showed their opinions. We thank you for your efforts. And the details are enclosed in the press kit. And among some of the frequently asked questions, we are currently providing some answers, and we are also going to provide some supplementary guidelines going forward, and they will be reflected in the guidelines to be released soon. And the KCDC today touched upon the issues of protecting our medical staff from the infections and to leave no blank and no space of loophole in our medical services. So we will be establishing a new system where we can treat these patients with respiratory symptoms, and we will also make a system to guarantee a safe condition for the non-respiratory symptoms patients. And during the winter and fall, as we could see another surge in the outbreak, we all had the same view that we need to be fully prepared for the respiratory patients. And we will designate clinics designated for these patients, and we will have a systematic services for these patients. And these clinics will be reflecting the opinions of the Korea Medical Association, and we will also be cooperating closely with municipalities. The local doctors will also be participating, and also the government will designate some of the facilities to be treating these respiratory symptoms patients. First of all, we will have these phasely opening, and they will be open throughout the nation with the help of the Korean Medical Association. And the government is also ready to provide any support that are needed in terms of administration, and we will also provide compensation going forward so that these clinics do not have any financial difficulties. And the exact guidelines will be disclosed sometime in early May after a close consultation with medical experts. And preparing for our prolonged COVID-19 outbreak, we will be implementing a more systematic treatment and therapeutics via the phone call, and we believe that we need to be equipped with more equipment. And as for local clinics, when they carry out the telephone diagnosis, we will be providing them with financial support in terms of telephone cost, and these costs will also be covered by the national medical insurance, and these will be in fully operating starting from early May. And this morning, we also established a new government and medical sector cooperation scheme to help any of the medical hospitals that are going through difficulties. And we discussed measures to provide them with financial support. We acknowledge the importance of these clinics which are helping to treat the patients, and we will be enabling these hospitals to focus only on treatment, and we will be providing and expanding the scope of pre-advanced payment of the national health insurance. And they will be provided for 2 months worth of insurance coverage so that they will undergo no financial difficulty. And the government also continues to acknowledge the hard work that are given by the medical staff members who are fighting on the front lines to combat COVID-19. And we believe that we will continue to provide compensation and respect to you going forward as well. The COVID-19 has not yet come to an end, and social distancing is also being prolonged. And the fact that we are moving to social distancing in daily lives does not mean that we will be ending social distancing right away. If conditions aggravate, we will be moving and we will be returning to the strict social distancing measures whenever it's needed. So we continue to ask for your participation. When we muster our strength and when we carry out social distancing and quarantine measures going forward, we believe that we can have our medical systems to control the system and to respond effectively against the COVID-19 outbreak. And we continue to ask you to comply with the personal hygiene measures, including coughing etiquettes and washing of your hands, and please cooperate with the measures put forth by the municipalities as well. And after traveling, if you have fever or respiratory symptoms, please do not go to work or outside. Please stay at home for the next 3 to 4 days and monitor your conditions. Especially tomorrow is a Children's Day here in Korea, and we believe that many people will heading outside. And however, it is difficult for us to enjoy what we did in the past years. I believe that the children would undergo great difficulties. However, we ask you to have a quality, happy family time. And we believe that these efforts will be our new norm in practicing social distancing in daily lives. And if you decide to go to amusement parks or events, please wear face masks and have 2-meter distance. And please refrain from going to crowded and enclosed spaces. We also ask the children to help muster your strength to combat the COVID-19 outbreak. Thank you very much.
Well, that was a live briefing from government health authorities you just heard there, and we were just told that there were 8 additional cases of COVID-19 in the country, bringing the total to 10,801. There were unfortunately 2 additional deaths, bringing the total death toll in the country to 252. That concludes our coverage of this morning's briefing, but we will be back in just a little while at 12 p.m. Korea time with our regular midday news. Bye for now.